Hi everyone. So today we'll talk about things that are done after your surgery. Now, on the day after your surgery, you'll find that you have something called an IV line. That IV line, you'll find it either on your hand, your arm, and we normally use it to give you IV fluids and IV medication. All right? So these IV fluids you're given normally just to keep you hydrated, especially if you're not supposed to eat anything on that day or any day after that. So whenever you're not supposed to eat, you're going to have those IV fluids running, or sometimes for many other reasons. Like for instance, if you've been vomiting, if you've been having diarrhea, if you've lost any large amount of fluids, we have to sort of replace it, okay? And they go through that IV catheter or IV line. The other thing you're given is medication. The medications include antibiotics sometimes, and pain medication, and some other medication depending on your condition. Now, about pain, of course, you've just had surgery, you have a cut on your skin. Now, the pain is controlled either with those IV medication, or sometimes you may just be given pills to swallow, or there are so many other modalities of pain control. Like you'd hear something like an epidural catheter, or some people get something like a patch. But the commonest ways that we use are the IV and the oral. That is, you take them by mouth. Now, you'll notice, apart from these things, is that we might come to you the morning of your surgery and insist that you get out of your bed. Okay? So many people, they sort of think that you need to rest for a bit after your surgery, for a few days. Now, that may not be a good thing. Why? We come and insist that you get out of your bed, at least sit on a chair, or even walk. The reason being is that when you lie down without moving, it increases your risk of having blood clots in your legs. And when you get those blood clots, there's a risk for that clot to go up into the lungs, and some people actually die from that. It's called a pulmonary embolism. Okay? So that's why you'll find us insisting immediately the next day after your surgery, you need to get out of your bed. Okay? Unless it is medically indicated that you remain on your bed, and that is something that we are going to tell you, that you should not be moving. However, if I tell you to move, there's a very good reason for it. Okay? Now, you're going to ask, you had been told that you shouldn't be eating anything before your surgery. So when do you resume eating? Now, eating is resumed when I tell you, because it depends on the type of surgery that you've had. I'll give you an example. If someone has just had thyroid surgery, the minute you're awake, you're fully awake, I can allow you to eat. Okay? You can start taking fluids and graduate into the solids. But if it's an abdominal surgery, it depends on the complexity of the surgery and what kind of surgery exactly did we do. So all those things, I would come and tell you, for you, let's give it a few days. For someone else, I can tell them to start taking fluids immediately. So it really depends, okay? I can't really tell you exactly today in this video. The other thing that you will find on you or coming out of you are so many tubes. So there's so many different types of tubes. There's something called an NG tube, that is a nasogastric tube. A nasogastric tube is usually inserted from your nose and it goes all the way into your stomach. The purpose of this tube is usually to do something called decompression. Decompression means that we remove all excess air or sometimes fluid that is accumulating and it's not going downwards the way it's supposed to be. So this tube, most of the time after surgery, we remove them. But for some patients, especially for emergency surgeries or some complex GI surgeries, we would leave that tube maybe for a few days and then remove them. Another type of tube is a urine catheter. It's very common for it to be used. Now, for majority of cases as well, after the surgery, we remove them. However, if we need to monitor your urine closely, that is, we need to see how much urine you're making exactly every 24 hours, then we're going to keep that catheter. Okay? Another type of tubes is a tube that is coming out of the area of your surgery. It may be a thyroid surgery, so the tube is coming out of your neck, an abdominal surgery, so the tube is coming out of your stomach. And so all these tubes serve different purposes. It's either to drain some fluid that may accumulate, or to drain pus, or to drain blood. Okay? Now these tubes, they remain there for as long as they're needed. If whatever it is that is coming out of the tube has reduced to a certain amount, again depending on when they are inserted, that's when we decide to remove them. And for some patients, we actually discharge them with these tubes. They're called drains actually, so because they drain fluid or pus or blood. So now you're being discharged home. So what instructions do you need to take with you? First of all, remember you had a wound, right? You had your surgery, so there's a wound. And that wound had a dressing. It's covered. Normally, we remove that covering or that dressing in 48 to 72 hours. So if it's not been removed at the hospital, let's say you were discharged immediately on the same day of the surgery or the next day, then you yourself, you can remove it after 48 hours. So when can you shower? Now, showering is okay after 48 hours, so long as we have not told you otherwise. All right? So you can shower, yes, but do not rub the area of the surgery. So that wound, don't go rubbing it. Don't add Dettol soap on it. As in, just, you can rinse it, yes, but don't rub anything on it. And you don't need to use any additional ointments on it unless we tell you otherwise. Now, how about activity? Can you go about your daily activities normally? Again, it depends on the type of surgery you've had. Generally speaking, you can resume your normal activities, yes. However, do not lift any heavy objects that are heavier than about 5 to 6 kgs for about 6 weeks. So the first 6 weeks after your surgery, do not lift any heavy objects. Heavy object is something heavier than 5 to 10 kgs. Okay? Now, depending on the surgery that you've had, we may tell you to abstain from that for much longer. Again, it's good for you to take initiative and ask. If I don't tell you, just ask. All right? So, what else do you need to do? Your medication. You're going to be discharged with a bunch of medication. Please, if you're prescribed some medication, take them, especially if they're antibiotics, because you need to finish that course of antibiotic. If they're pain medication, take your pain medication, but avoid driving, especially if the medication are those that make you drowsy. So do not drive yourself when you're taking such medication, because you can get into an accident. Yeah. And then the last thing is, what if you don't feel better? Something goes wrong, the wound has a problem, or anything, you're just not well, a complication has developed. Please Do not wait and go back to the emergency room. Don't wait to call your doctor on their personal numbers, because he or she may be in the middle of surgery. They may not hear your phone call. They may not be able to pick up because of one or two reasons. So just head straight to the emergency room so that you can be helped. Thank you for watching. Until next time, stay healthy.